It's another day with the physicians where your health is our business. The growth spot the end, so you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what is low?
You're welcome back to the training of your regular program.
Children with autism, some of them, not all, they just like to be by themselves.
Polycystic Ovarian Syndrome, also known as PCOS, is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. It is common among women of reproductive age group. Women with PCOS may have frequent or prolonged menstrual periods or excess male hormonal levels. The cause of polycystic ovarian syndrome isn't well understood, but may involve a combination of genetic and environmental factors. What are the predisposing factors? Is this a cause of infertility? Today, on your regular health TV talk show, The Physicians, our guests will be enlightening us more on polycystic ovarian syndrome, the causes, symptoms, and management. It's another day on your regular and favorite health TV talk show, The Physicians, where your health is our business. On today's show, we will be talking about polycystic ovarian syndrome. Again, this is another issue the women do face. But of course, the men are always there to give support all the way. My name remains Dr. Memuna Yusuf Kadri, and always my co-host is always by my side. And she is
Dr. Martina Agberian. Welcome to your regular program, The Physicians. Of course, your health is always our
business. PCOS.
Polycystic ovarian.
The physicians, should we say it's women health? No, I don't understand.
Because like there's a lot of challenges. The
too much. That's everything that has to women this,
there's
women that.
Because that the woman is not involved.
A factor. They say everybody was once a woman. Before you became a human being, in the process of growing up, the eggs, before the changes. Everyone was once a female.
Yes. For patients that have a
PCOS,
are the ones that I've seen actually presented with their periods flowing for over 2-3 months.
Who wants that?
Over
period.
3 months.
That means you don't have a life.
But they never knew. They just thought, so what's going on? This period has just
period every day.
Every day.
For 30 days, for 16 days, 90 days.
Full.
No, that is not normal.
And they never knew it was. After doing investigation, hormonal assays and everything, did scan
and all.
Of course, there was this weight gain. Young girls, I'm telling you, young girls, weight gain and everything. But at the end of the day, it's something that can be managed, actually.
That's the beauty about PCOS. Once a medical condition is manageable, for me, it gives me that assurance that, thank God,
is actually
detecting on time and timely intervention.
Exactly. And thank God for the physicians who always like to enlighten people.
This is the reason why we are here, because your health is our business. We'll be right back after this time out to bring in the expert who will school us on what polycystic ovarian syndrome is all about. just joining us, this is the Physicians Where Your Health Is Our Business. On today's show, we are talking about polycystic ovarian syndrome, the symptoms, predisposing factors, and management. And with us in the studio today is a regular face, a renowned obstetric and gynecologist. He has been schooling us on so many important topics regarding women. He's a medical doctor, a specialist, and is the MD CEO of LOUISMED Specialist Hospital and Fertility Center. Is no other person than the known and world-renowned Professor Akinloye Bamigboye. You are welcome on set, sir.
Doing?
No, we're doing fantastically great. Thank you. We were awarded one of the best hospitals in Nigeria this year.
Oh, wow.
Yeah.
Congratulations.
So, thank you very much.
In spite of the COVID.
Exactly.
Yes, so-
I know
You are giving your all.
Yeah.
Yeah.
And then we deal mostly with women, but we do everything. But then when you mentioned, Dr. Producer, that it's women that are mostly affected with problems. But that is not true, because men
have
also
their
have
own issues.
But you recollect, the life expectancy or the lifespan of men is actually less
than women.
So therefore it means that diseases that men
The
really do have,
lifespan of men.
less than that of women
In Nigeria or globally?
globally.
Do you want to just give me one or two reasons why they should be?
Well, you see, why I can't tell you. We are stressed up. We are stressed. You see, when you stress, your blood level of cortisol, which is a hormone, it rises. And when your cortisol rises, your BP then rises. When it does that, your sugar level increases. And when your sugar level increases, you have diabetes. And when that happens, then you're going to end up dying.
Well,
What I do, the women will have their PCOS, they have their
I don't know that things that comes with it.
those small things.
I know it's always said.
the women don't expect, but just like they manage it properly.
Yeah.
If you ask me in my
Manage,
house,
don't
if you ask me what is my stress level, I'll tell you that paying school fees is huge. I'm not going to allow my wife to start looking for it. I will look for it.
Oh.
And the stress therefore will come to the man.
To the mind. That's
always
true.
have what you want when you come back.
I know the exciting thing about this area of specialty when it comes to obstetric and gynecologists, we have more males, but it's 1% area. It's for women, right? It's mainly about women, right? But we have more males in that specialty. That's the topic for another day. But let's deep dive into polycystic ovarian syndrome. Sir, give us a
General overview.
of
Because PCOS
Yeah.
or polycystic ovarian syndrome is an affestation of women of reproductive age group. It's very common indeed. Millions of women in Nigeria are affected.
Seriously?
Perhaps let's say 5 to 10% of women are affected.
Wow.
Many more are affected, up to 70% in women who do not have babies, who are not ovulating. Because ovulation is a function of many things. But if you ovulate and it's fine, good. But if you don't ovulate, you cannot have a baby.
Yes.
So many women actually have that, and they will not know. The age group is quite legion. It's between 20 years, even earlier than that, to 50s. So women presenting with infertility, 70% of them who are not ovulating will have PCOS. Can you see how common that is? So that's the problem that we have in Africa, and we have in the whole world actually. And PCOS is actually problem of menstruation. The symptom is menstruation based. Menses in the sense that a woman who bleeds irregularly, a woman who has menometrorrhagia, the one you were trying to describe, that the flow for a long time is called menometrorrhagia. Metro like a rail. So that's kind of, if a woman has bleeding like that, the doctor, the gynecologist must think of PCOS. Yes. And other things. If a woman has also things like excessive hair in the neck, hair in the body, hair in the face.
Exorcism,
then you must look at the ovary. And then PCOS is actually diagnosed with a scan where you have concentric rings around the ovary, the outside of the ovary.
Let's not go into that.
Going to the diagnosis, the scan. You said it's actually very common.
Yes.
And you described the flow continuously, like in the metrorrhagia. Okay. And let's see. Is it, before I go on, is it possible for somebody, a female, to be seeing her period and not ovulating?
Yes, we see that a
Because I will
lot.
tell you they are seeing their period, but
They
are not
Mm.
ovulating.
We've seen that a lot because PCOS is not only bleeding excessively. There are moments when you don't even bleed. If you don't bleed, then you are not ovulating. So any condition that will not make you to ovulate will be associated with PCOS.
Mm.
Women will not bleed. Oligomenorrhea, they bleed less. Polymenorrhea, they bleed too much. Menorrhea, heavy flow. Menometrorrhea, the one that you described earlier, they bleed like a rain, like a train, yeah. So those are the things that we see in PCOS.
So
Very common.
because you have said it's very common.
Common.
Yeah.
And unless the individual has this bleeding or goes to see a doctor, you won't even know. Even the mothers at home may not even understand why the daughters are bleeding like that. What are actually the predisposing factors? What are the main things? Apart from just saying hormonal disorganization, the hormones are not balanced. What is the main thing? What are the predisposing factors?
You see, I can tell you that it is hormonal based. When you have excessive male hormones, testosterone, in the blood, that is when the ovaries are misbehaving.
So before you continue, you want to just let them know that every female, male, or in fact everyone has an element of the male hormone and the female hormone. So the females also have an element of testosterone.
Yes.
Why the male also have an element of estrogen?
Yeah.
Okay.
Yeah, that is true. So some women are actually very scared when I tell them that, oh, I've just done your results, your blood test says you got excess testosterone. What?
I'm a woman.
Because I'm a woman. Where do you look at it? Is it a cancer or not? So no, you don't have a cancer. It is just excessive testosterone that you have. Because every woman or every man has got element of both hormones in their system. So in PCOS, we have excess testosterone. And then you have this presentation of the breast being smallish, they are obese a bit, they are bleeding regularly, they are not ovulating, therefore they present with infertility.
What will make the testosterone excess? I need to know that.
Okay, I wish I know, because if I know, I'm going to get a Nobel Prize. I do not know it, but
I like that.
we think that the body is producing too much testosterone. We don't know why. It could be genetic.
Prof, being in this field and being there scientifically and all that, in Nigeria, are there researches that shows a particular tribe have more PCOS than others? And globally, are there some variations?
The research did not really emphasize differences in tribes as far as PCOS is concerned. It's just that the quality or the method of research may be different, and then they can come up with different results. But generally speaking, there's no particular tribe that is more than the other. But we just know that most people that are obese, really, the chances that they're going to have PCOS is extremely high because of the insulin insensitivity. Insulin is that hormone produced by the pancreas, which in PCOS they are not sensitive enough, and then you end up producing more insulin, and that's why we do insulin tests when the woman has got PCOS. And that's why we actually put them on metformin or similar drugs to lower the
insulin
insulin
in the system.
Is it likely to be a cause of infertility?
Yeah, it definitely yes. Why? If a woman has PCOS, she's not going to ovulate. The chances that she will ovulate is extremely tight. So one of the methods, therefore, that we use is to treat the primary problem, which is hyperinsulin problem. The insulin is not doing well, so you give insulin drug, then they ovulate. So can you see? It's cause and effect.
Yeah, cause and effect.
Yeah.
Prof, it's good we are diving into this, and so because girls, when they grow, they are all bred up. One day, if you want to have a family, you want to marry, you want to have children. So getting to understand this earlier in life is very important. We want to go to the street now. We're keeping up with the physicians to ask you if you've ever heard of the word PCOS before. And if you have, What have you noticed? Any friend, relative, maybe your mom, your sister that has gone through that before? Let us hear from you. We'll be right back after this short break.
Okay, the only disease I know that, not disease actually, like the only one I know is infection and mostly abortion.
From my own little understanding, I think the simple English for it is hormonal imbalance in either men or women, but particularly among women.
Polycystic of the ovaries. The only thing I know about it is it's mostly common among the women, and it's like it comes in a way of longer menstrual period.
Well, I wouldn't know. Environmental factor can cause it. I think then my own, I was told depression.
Not really. I don't know about it. Yes and no.
Yes, as I was told then, that it can cause infertility, and not only that, untreated infection can also cause infertility.
Welcome back. If you're just joining us, this is the Physicians where your health is our business. We have been discussing polycystic ovarian syndrome, and this is a disease of the women again. But what is most important is that we know there are what we call predisposing factors. What will make you be at risk of this disease? Do you smoke? Do you drink? Are you obese? These are some of the known factors that are affiliated to PCOS. And the truth about it is that it can actually lead to fertility. But what is the game changer? Knowing it on time, and of course, timely intervention. And we have, of course, the renowned Prof that has been schooling us a lot on what PCOS is and what we need to do. Now, Prof, how do you diagnose PCOS and what is the management?
Thank you very much. We have by manual examination whereby we check using our fingers whether the ovaries are enlarged or not in areas where there are no ultrasound scan. But that may or may not give us an idea. Then we go ahead and do ultrasound scan. Ultrasound scan will definitely tell us whether they are ovaries, whether they are cysts in the ovaries. The cysts they are arranged in a peculiar manner. The manner is a concentric arrangement, the round arrangement of the cyst, like a ring. So when you see that, oh, the PCOS, fine. And we see this in women who come in complaining of infertility, complaining of abnormality in their periods, and then we then say, oh, she may likely have PCOS. Then, therefore, you look further. What is happening to this woman's face? You look at whether they are SSA, whether she's obese. When you have a BMI of above 30, then you start thinking, oh, this woman might have PCOS. And then you ask about the period. Is it irregular? Is it regular? Is it this or that? And then you can have PCOS. Then we then put blood. We take blood. We take blood in the woman. Then we assay for the testosterone. We assay for the estrogen, the progesterone, the FSH and the LH. The follicle stimulating hormone and the LH, they have a special ratio, in them. But if it's abnormal, you will know. Then you can say, oh, this woman has got PCOS.
So managing it?
Management of PCOS, it depends on the presenting complaint. When a woman comes in with menorrhagia only, or menorrhagia, or whatever it is, you can actually give them a little pill to correct the period. Or you say, okay, this one has got this and that, then we can give their specific anti-androgens that you can use. Or you can go to the simplest of all, which is the basis of PCOS. You can give metformin, the insulin medication. Most of them will have abnormality in that. And many people will react or will respond to insulin treatment, so metformin. So we give them metformin, let's say, in a low dose, and then we see the response, whether whether the period are controlled. Because when you give metformin, the woman may end up falling pregnant. So if a woman who is ready to be pregnant, give metformin, and that is it. If a woman is not ready, then you have to think twice, or you have to advise to use barrier contraceptive, or you use a COAC, which is the pill, and then you see what to do. Then if a woman presenting with PCOS, you have tried all those, you are still not getting well, surgery is being used. It was commonly used in the past, I can tell you, but researches have been done of recent that surgeons are very wary of doing that. And the surgery is called laparoscopic ovarian drilling. We do a keyhole operation. We put a laparoscope there. It's an instrument through the belly button. We look at the ovary, then we put puncture. We puncture the ovary so that the cyst can drain out.
Won't it regenerate?
Yes.
No, well, it will decrease, and then you can top it up with the medication.
Okay.
And then you advise them what to do if they are planning to fall pregnant quickly. You know, those are the things. That is the ovarian drilling. The reason why surgeons may be running away from ovarian drilling now is that the research that came was when you are trying to drill, you are actually killing off some of the normal cells, and then there could be premature menopause. You know,
don't compound the person's issues.
Yes. So that's why we don't do that.
So you talked about the management. Okay, I want to just ask: is there a hereditary genetic link here?
Yeah, there is. There is definitely, yes. You have a woman whose mother has got the same problem in the past, but they will not know. You know, in the past, people don't know that. But when I was in medical school in the 1980s, we really talk about PCOS. It was only in the 90s that we started.
Because that's medicine, involving medicine.
Yes. So,
Prof, once again, thank you so much for this. You've just clarified so many things that some people may be, didn't take cognizance of, especially for the singles out there who want to, settle down, have a family. These symptoms we talked about, are you experiencing any of these, menstrual flow, irregular, if it comes, it stays for too long, heavy bleeding? You are big on, obesity is not a medical condition, like it's a disease right now. Are you big? Are you, that weight that you think is excess? There may be something wrong somewhere. Because truly, if you want to have babies, PCOS could be a reason for infertility. But understand that there's a game changer, knowing it on time, and of course, timely intervention, because PCOS can also be managed. My name remains Dr. Memuna Yusuf Kadri.
Thank you very much, Prof, for coming on our program.
Thank you.
And I'm sure you actually heard it from him too. PCOS it can actually be managed. But the important thing is see the professional so that they can detect and treat you adequately. Do not just go on using medication, hormonals, I'm bleeding, I just take this medication and stop. You need to be properly investigated. Don't forget to follow us on our social media handles. Instagram, Facebook, and of course, if you have never watched this program before, your first time, all the past episodes are on our YouTube page. You can always catch us on our YouTube page. My name is Dr. Martina Agberian. Stay blessed.
My name is Sheyido. I'm a consultant orthopedic surgeon, special interest in orthopedic oncology. I've just been on the Physician, where you get all your health information. We've talked about lumps and bumps, the importance of it in various parts of the body. Remember, if you pick any lump or any bump on your body, get it checked out as soon as possible. Early detection can lead to cure, and the chances of better outcome is always better with early detection and evaluation. Thank you.